Where are the global COVID-19 resources for LGBTI communities? Next slide, please. My name is Matthew Hart, and I'm the director of the Global Philanthropy Project, or GPP. And the report we'll talk about today tracks a very significant shift in the global LGBTI movement and funding landscape that has happened as a result of the COVID-19 pandemic. Many LGBTI organizations this year have, by necessity, shifted their focus to addressing basic needs of our communities and have been able to do so in part because of many of the existing LGBTI funders' flexibility and willingness to significantly change their grant agreements, among other things. Shockingly, the report also finds that LGBTI communities have been almost entirely excluded from LGBTI COVID-19 humanitarian responses, continuing the historical invisibility of LGBTI issues within the international humanitarian systems. If these dynamics continue to play out in 2021 and beyond, it will have a significant long-term implications for the global LGBTI movement and, in fact, for LGBTI philanthropy, which is explored in detail in the report and will be the nature of our presentation and our discussions today. Before we move on into this next piece, I do want to take a pause and just acknowledge that as of today, there are more than 2 million people that have died because of COVID-19. And they were our colleagues and our friends and our families and our lovers and our neighbors. And that is an enormous loss, and we miss them. So it is in their honor, in their name, that we step into this report and this conversation. And together, we're going to explore the findings of this news report and in more detail and have a panel discussion with our 4 different institutions and how they have and are continuing to respond to the pandemic and their organizational experiences during the past year, as well as their assessment of what kind of path forward we need to build together. Right now, you're looking at a slide that's basically how we're going to organize the time together. But before we begin that, I'd like to share some of the logistics for this call and from our time together. So the report and the speakers' bios can all be accessed on our event page, which you can now see in the chat box. Today's webinar will be recorded and will be held in English. The webinar will not be held using video. GPP's practice is to not use video to ensure that the largest number of people from all over the world can have stable internet participation on this call. Moreover, we hope that this ensures that our focus will be on the speakers' contributions and the report findings. Throughout the webinar, please use the Q&A function to send us your questions. The GPP team will harvest and curate those for our panelists. And as a quick reminder, this is a non-solicitation call. And as a friendly reminder to our speaker, as we just said, English is not the first language of many people on the call. So I just want to thank you in advance for avoiding any slang or jargon and defining acronyms and working to speak clearly as we enter into this discussion. At the end of this call and then shortly thereafter, you'll receive an email, and that email will have a recording of this call, all the PowerPoint slides, and a link to the full report that you can still find on the webpage that that Marina just posted. And finally, we'll send out a post-webinar survey, and this survey helps GPP to really improve and continue to do our work to increase and improve resources for LGBTI people in the global South and East. Let's go to the next slide, please. So GPP is a collaboration of 21 private and public foundations and philanthropic advisors. Together, we work to expand the global financial support to advance human rights of LGBTI people in the global South and East. GPP regularly commissions public and private research. We support our member working groups and task forces. We host donor pre-conferences in advance of civil society gatherings all around the world. And we work with a cohort of wealth advisors. GPP regularly hosts member-only telebriefings, as well as public webinars, like the one today we're on, for the broader philanthropic and development communities, as well as our civil society partners from around the world. So welcome, everybody. So who's in the room? I want to welcome everyone, the many hundreds of participants to this call. As of last night, we had about 420 people registered, 150 grant makers, 200 humanitarian and development actors, 40 government and multilateral agencies, 10 wealth advisors, and people from every continent except Antarctica. So that's pretty cool. So I think that also shows that this is a very timely and relevant conversation, and I think we have the right people on the call to talk about it. Let's go to the next slide, please. So now I have the real pleasure to introduce my colleague and co-author of the report, Dave Scamell, who's GPP's Senior Consulting Advisor for Government Relations and Field Engagement. So Dave, I'm going to pass it over to you. Welcome.
Thanks so much, Matthew. And the next slide. In April 2020, the Global Philanthropy Project launched a short survey of LGBTI funders in order to understand the initial response of global LGBTI philanthropy to the pandemic. A key outcome from that report was a recommendation that GBP monitor shifts in resource flows to LGBTI movements and communities, as well as the broader impact of COVID-19 on international development and humanitarian assistance funding. 6 months into the pandemic, we conducted the COVID-19 Global LGBTI Funders Survey of the leading government, multilateral and philanthropic funders of global LGBTI issues. When we started this research project in the early days of the pandemic, there was real concern amongst LGBTI civil society and funders that the unprecedented economic impact of the pandemic would cause a significant drop in the level of funding for global LGBTI issues, and that many existing funders would be forced to reduce or stop funding movements altogether. So we wanted to test that assumption. And in doing the research, we actually discovered a much more complex set of findings about how the global LGBTI movement and its funders had responded to and plan to respond in the future to the impact of COVID-19. There are three components to our research. The first is the survey itself. We had 24 funders who participated in the survey, and together they represented just under half of all global funding on LGBTI issues, excluding domestic US funding in 2018. Secondly, we did a literature review about the impact of COVID-19, particularly on LGBTI communities. And this literature review was complemented by the collection of case studies of LGBTI organisations from across the world responding to COVID-19, which were submitted by our members of GPP. These two components highlighted that LGBTI organisations and their funders in 2020 had been engaging in humanitarian response work to address the basic needs of their communities. So we wanted to understand the extent to which LGBTI issues and communities were included within the money that was mobilised by the world's largest donors to respond to the significant humanitarian challenges that the pandemic presents. Therefore, our third research component was an analysis of all global COVID-19 humanitarian response resource flows as tracked through the Financial Tracking Service database, which is run by the UN Office for the Coordination of Humanitarian Affairs. We went beyond that and looked at and reviewed the COVID-19 global strategies, plans, and guiding statements of the top 5 largest donors to the COVID-19 global humanitarian response, as well as the top 20 recipients of that funding. Next slide, please. As the impact of the pandemic became evident, LGBTI organisations in every region of the world shifted their programmatic focus towards stopping the spread of COVID-19. Organisations like Sabha Habona in West Bengal. As COVID spread across India, already marginalised groups such as the trans community faced increased challenges in accessing food and basic healthcare, and in some instances, safe and adequate housing. In response, Sabha Habona, through online community donations and support from the International Trans Fund, raised resources that enabled them to provide access to food, essentials, and medical support, including free or subsidised medication, to more than 900 individuals across West Bengal. Next slide, please. The work of Salem Harbona in 2020 is reflected in the responses that LGBTI funders gave in our survey. More than 80% of the funders who responded said that many or most of their grantee partners had shifted focus in 2020 from existing programs to providing services to reduce the spread of COVID-19 amongst their community. Similarly, more than 80% of funders said that many or most of their grantee partners had shifted focus to providing livelihood, shelter, or other forms of assistance to address the secondary impacts of COVID-19. And our findings align with the analysis done of more than 1,500 applications from 131 countries that were received by Outright Action International to their COVID-19 Global Emergency Fund, of which more than 80% of those applications were focused on providing basic humanitarian relief to LGBTI communities. Next slide, please. Among the 24 funders who responded to our survey, we asked them about their forecasted budgets for LGBTI grants in 2021. And amongst those 24, the total funding for LGBTI issues, excluding domestic US funding, is expected to increase by 20% this year from 2018 levels. 19 of those funders indicated that they plan to increase their LGBTI funding this year compared to 2018. 3 said their funding will decrease, and 2 said it would stay the same. While this is obviously a welcomed and positive finding, we also acknowledge in the report that there are a number of factors that point to ongoing uncertainty about funding levels for LGBTI organisations in coming years, including the impact that economic conditions on donor countries will have on overseas development assistance levels from major donor governments. And this was reflected also in the feedback that funders have received from their grantee partners about ongoing concerns about funding reductions as a result of the pandemic. Next slide, please. LGBTI organisations have been able to do this pivot to address humanitarian needs, in part because of the flexibility of many of their existing funders. From our April 2020 initial survey of the global LGBTI philanthropic field, 85% of the respondents said they had adopted flexible funding practices, and almost 70% had allowed their funding to existing partners to shift from project or programmatic funding to general operating expenses. It's important to note here that the existing funders of LGBTI organisations, including the 24 who participated in our survey, are largely human rights funders and/or adopt a human rights-based approach to their grant making. And we know from the grants that GBP tracks through our biannual Global Resources Report that these funders largely fund advocacy and community organisation work rather than direct service delivery. Next slide, please. Pre-pandemic in recent years, there has been growing evidence around the specific impact of humanitarian crises and disasters on LGBTI communities, demonstrating how existing vulnerabilities of LGBTI people are exacerbated in times of crisis, and more so can result in particular challenges in accessing services within humanitarian responses. At the same time, there has been increasing organising and advocacy by LGBTI organisations to engage with the international humanitarian system. And I would encourage everyone to look at Appendix 1 of the report, which provides links to further resources and evidences around the impact of humanitarian crises on LGBTI communities. As the pandemic was declared in March 2020, the UN Office for the Coordination of Humanitarian Affairs released the UN COVID-19 Global Humanitarian Response Plan, which outlined a coordinated response for the plan for the international humanitarian system. Very limited mention of LGBTI issues were included in the original document. An update to the plan was made in July of last year, and by that stage, there'd be increase in documented impact that COVID-19 was having on LGBTI communities, which resulted in the updated plan providing much more detail on how LGBTI people were a specific at-risk population in the pandemic. The heightened vulnerability of LGBTI communities to COVID in the 63 most at-risk countries identified in the Global Humanitarian Response Plan is evident in the significant legal and social discrimination that they experience, which impacts their ability to access humanitarian response relief services in the first place. Of the 63 priority countries in the Global Humanitarian Response Plan, same-sex relations are criminalised in just under half. Of those 63 priority countries, only 17 scored more than 5 out of 10 for social acceptance of LGBTI people between 2014 and 2017, as outlined in the Global Acceptance Index produced by the Williams Institute. Given this challenging legal and social environment, there may be an assumption that LGBTI communities are too hard to reach or do not have the capacity to partner with and or receive financial support from humanitarian actors. However, analysis from our 2017-2018 Global Resources Report showed that LGBTI-led organisations in 50 of the 63 priority countries in the Global Humanitarian Response Plan received grants. Further analysis by Outright Action International from their COVID-19 Global LGBTIQ Emergency Fund showed that they received funding from LGBTI initiatives to specifically address humanitarian aspects of COVID-19 in 45 of the 63 priority countries under the UN's Global Humanitarian Response Plan. And I encourage you all to look at Appendix 2, which is on page 31 of our report, which actually outlines each of those statistics for each of the 63 individual countries. As the Global Humanitarian Response Plan acknowledges that LGBTI communities are a group in particular need of protection against the impact of the pandemic, it's imperative that humanitarian actors follow the lead of the Global Humanitarian Response Plan and take steps to address LGBTI needs in this ongoing pandemic. Next slide, please. As of November 11, 2020, over $6 billion US had been committed by government and multilateral donors, as well as private sources, to address the humanitarian impact of the global pandemic, based on data available from the UN's Financial Tracking Service database. And just over half of that funding, $3.4 billion US, was specifically tied to the Global Humanitarian Response Plan, with the remainder dispersed through a range of other humanitarian funds and appeals. What we found in looking at more than almost 4,500 recorded resource flows addressing COVID-19 through the Financial Tracking Service is only one explicitly described funding to support LGBT communities. Just to emphasize that, of the almost 4,500 recorded resource flows tracked by the UN to address the humanitarian impacts of COVID-19 up to November 11th, 2020, only one explicitly described funding to support LGBT communities. Now, as the project description for individual resource flows in the FDS database and similar database could often provide limited detail, we went further by doing a review of the response plans, public statements, and official website information on the COVID-19 humanitarian response from the largest donors to see what we could find. Among the top 5 donors, all of whom are government or multilateral agencies, who account for more than half of all humanitarian resources committed to addressing the impact of the global pandemic, none explicitly identified LGBTI communities as a vulnerable or at-risk population in their COVID-19 humanitarian response plans. And I point you to figure 5, which is on page 20 for more specific information of those 5 donors. Similarly, a review of the top 20 recipients of humanitarian funding for global COVID-19 response as tracked through the Financial Tracking Service paints a similar picture, and that can be found in figure 6 on page 21. Despite the lack of inclusion of LGBTI communities in response plans and public statements, there are examples of some of the leading humanitarian actors, at least occasionally partnering with local LGBTI community organisations to address the impact of COVID-19 on their local communities. And some of these actors, particularly UN agencies, have scaled up their programmatic focus on LGBTI issues in recent years, although mostly focused around development and human rights streams. Still, the exclusion of LGBTI communities as an at-risk or vulnerable population within COVID-19 response plan and public statements suggests that humanitarian resources pledged by the world's largest donors are not systematically or directly targeting the needs of LGBTI communities. Next slide, please. And in the last section of our report, we outline what we see as a number of significant possible implications of this. First, already overburdened LGBTI organisations will be stretched even further. Although GPP has tracked an increase in global LGBTI resources in recent years, this has been more than matched by the growth in organisations working at all levels to advance the rights of LGBTI people. And the challenges that they will need to address is only increasing. Since we wrote the report, it's become clear that the virus itself is not going away anytime soon, and the inequality of access to vaccines between the world's richest and poorest countries means that the pandemic will continue for a number of years. The economic and social implications of COVID will remain far longer. In October 2020, the IMF predicted that the pandemic will reverse the progress made since the 90s in reducing global poverty and will increase inequality. In this context, difficult choices will need to be made about what work is prioritised as LGBTI people continue to be excluded from health and other social services, pushed into poverty as a result of the economic consequences of the pandemic, and targeted for discrimination and familial and state-sanctioned violence. Next slide, please. The second implication is this will impact the capacity to advance human rights and respond to anti-rights attacks. While many LGBTI organisations are facing challenges in accessing the resources they need to respond to both the immediate humanitarian impact of COVID on their communities and also defend their human rights, conservative actors and forces are receiving significant external funding, enabling them to attack LGBTI people and other communities. I encourage you to check out our website for a forthcoming report entitled Meet the Moment, which tracks the disparity of funding and the significant amount of resources that are flowing to conservative forces that are attacking LGBTI communities in every region of the world. At a global movement level, the programs, strategies, and networks built to advance LGBTI human rights will come under enormous strain while LGBTI organisations struggle to access resources from sources such as humanitarian funders. At an individual level, there is a real danger that the demands on LGBTI activists from the pandemic will only intensify the levels of burnout and trauma previously documented in the global LGBTI movement. Having said that, an important implication of our findings is that this is an opportunity, and the pandemic and the moment we are in presents an opportunity to break down the invisibility of LGBTI issues within the international humanitarian system. As Edge Effect, which is a leading organisation working around LGBTI and humanitarian issues, has noted in a briefing they did last year, this crisis is an opportunity to model diverse, SOGI-esque inclusion within relief and recovery, to build awareness of LGBTIQ+ issues, establishing new partnerships and create new expectations for future programs. There has been a significant push for reform within the international humanitarian system in recent years. At the 2015 World Humanitarian Summit, the major humanitarian actors agreed to scale up support for local and national actors in responding to humanitarian challenges. This localization agenda, as it's called, creates a pathway for greater engagement with LGBTI organisations. When the pandemic hit, LGBTI organisations across the world were already embedded within their community as frontline defenders against human rights violations. So it was this trust and networks that enabled so many to be able to pivot to addressing humanitarian needs facing members of their communities. Some humanitarian response actors may assume that LGBTI organisations are too small to manage the type of grants that are awarded for humanitarian response. However, as we note in the report, and as we've tracked through our research for a number of years now of the global LGBTI funding field, a sophisticated LGBTI funding infrastructure has emerged in recent years that enables large-scale donor funds to be dispersed to local and national LGBTI organisations through intermediary funding mechanisms. Indeed, many of the major donor government agencies funding the humanitarian response are already using these mechanisms to support LGBTI issues through their human rights, democracy, rule of law, or development streams. And the last implication that we note in the report is that addressing humanitarian needs may require new skills and relationships for LGBTI groups and their funders, as well as humanitarian actors. Most of the leading LGBTI funders consider themselves largely human rights focused, with networks at both the institutional and program officer level focused on the human rights, philanthropic and practitioner field. Very few would consider themselves humanitarian funders, and connections with humanitarian donors and implementers are limited. At the same time, for many humanitarian actors, the historical lack of institutional focus on LGBTI communities and their specific issues means that there will be a need for increased knowledge and competency about the specific needs of LGBTI communities in humanitarian contexts. An important part of this process must centre on how to effectively work with LGBTI organisations and communities. And to dig into this and other long-term implications that we found through our report, I will turn it back to Matthew to introduce our panel of respondents.
Dave, thank you so much. And thanks everybody for those of you who may have just joined or have joined during the course of Dave's presentation. I'm really, truly thrilled, and I have the pleasure of introducing our guests who will have a conversation together about this report. As a reminder, all of the bios are on our homepage for this event, so you can find them all here. And so first I'll just introduce everyone and then I'll get right into our questions. So our first guest is Caroline Kwasiyaman, who's the Executive Director of ISDAO. April Pham, who's the Senior Gender Advisor and Head of the Gender Unit at the UN Office of Coordination of Humanitarian Affairs. Nikki McIntyre, who's the Chief Executive Officer at the Foundation for a Just Society. Jessica Stern, the Executive Director of Outright International. So thanks everybody for all of you for taking the time and preparing and joining us. And each has provided unique and extraordinary leadership during this crisis. And it's pretty humbling to have this conversation. So I wanna encourage everybody who's attending to help us out and use the Q&A function if you have any specific questions for our guests today or the authors of this report. But first, I'm gonna turn to you, Caroline, if you don't mind. I'll visit with you first. Welcome.
Thank you.
As you reflect on really how COVID has impacted the communities that ISDAO works with in West Africa, does this, it's kind of a two-part question. Does this report like resonate? Did the findings resonate with you? And I also know that we'd all like to hear about some of the specifics of what ISDAO has done and what your partners are doing to shift their work in response to COVID-19.
Okay, great. Thank you so much. Maddie, can you still hear me?
Perfectly.
Okay, wonderful. Hello, good afternoon, good evening, good morning to all. My name is Caroline, and I'm tuning in today from Accra, Ghana. And for those of you who are not familiar with ISDAO, ISDAO stands for Initiative Sankofa d'Afrique de l'Ouest. We are a West African LGBTQI activist-led organization and led fund. And part of the role that we play in contributing to strengthening the movement of West African LGBTQI people is through grant making. And so that is one of the key ways in which we engage and we work to strengthen the movement, particularly working in 9 countries within our region. So I'll talk briefly about what we've done and also make a few points about how the report resonates with our reality. And just to say that one of the key things for ISDAO throughout this past year has been around maintaining one of our core values of being flexible and being a flexible grant maker. And what we found in that flexibility is that it did enable many of our grantee partners to be able to pivot, to respond to the emerging and evolving, and I think that's evolving is really important, and dynamic realities of the COVID epidemic within their communities, within their countries. So we found that about a third of our partners did revise their grants or grant activities to include direct support, so paying rents, providing cash transfers, food kits, access to medicine, actually paying for peer educators to take key medication to community members, because this was at times when mobility was restricted. Providing PPEs, so providing hand sanitizer, masks, etc. Doing and shifting their programming to ensure that community members can stay connected and are still able to access information, access resources, even with an evolving or changing context. So that's been really important. Two other interventions for ISDAO that for this in the last year. One is we wanted to really increase the level of resources for responding to emergency, safety, and security concerns locally. And to ensure that more resources were available in country, that organizations, our grantee partners themselves could determine how to use those, and that when things came up, there were already resources in the bank to allow for that frontline response while assessing the situation and identifying what other resources were necessary. And that has been critically important at a time like this where things are dynamic, and even responsiveness from funders has been impacted by the current situation. In addition, we introduced a resilience grant, so additional mechanisms to provide very core flexible support, short-term support to partners who had lost funding or were otherwise adversely affected in terms of their operations during this time. And so it enabled them to respond in a very flexible way to things that have been coming up within their organization. So those are some of the specific ways, of course, in addition to helping partners access some of the other opportunities and resources that existed to respond to COVID-19 and the COVID-19 epidemic. I just wanted to make maybe 2 points about the report. And I think, and I actually don't want to go in a lot into the context, because I think the report of the impact of COVID-19 on our communities is very comprehensive. The report by Outright International is also very comprehensive. And I would also refer people to a recently released report by African Queer Youth Initiative that looked specifically at the context for African queer youth and young people. And I think that's also an excellent report around the context. In terms of this report, I think it was exciting and encouraging to see that many LGBTI funders, for the most part, have not reduced their funding. I think Dave talked about this in the beginning. There was that concern that would happen, and it was encouraging to see that actually most LGBTI funders who responded were maintaining, if not increasing, their level of resources. I think what is interesting is there's also a gap, because what we're hearing and what we're seeing locally is that that's not always the case. We're hearing about funding not being renewed. We're hearing about delays on funding, delays with disbursement of current commitments. We're hearing about insistence of targets being met, especially with HIV funders, without a recognition that there might be a need to revise. So there's a gap between, I think, what this report is presenting and some of the things we see within the region. And I think there's a question of how can we as funders better communicate and be more transparent with our partners about our constraints and our intentions. And the other point that I would make about this and how this report resonated was, I think, the gap that you both really spoke about with regards to humanitarian response actors' inclusion and responsiveness to LGBTI or communities and organizations. And I want to share very quickly a quote from one of our partners that we received last year when we were doing some initial assessment. And we asked, were they able to access any humanitarian organizations or humanitarian response? And of our 27 partners, not a single one had been. And I want to just read this quote before handing it back to you, Matty. The organization said, "We would like to clarify that some non-LGBTI organizations and foundations are mobilizing to help poor families and vulnerable LGBTI people. Therefore, as an LGBTI organization, on this point, we cannot press for access for LGBTI people alone. Some organizations might say they are not working on LGBTI issues, but we inform them that the word destitute person or marginalized person is general and includes all sexualities. Emails in support of our community have been sent to powerful humanitarian organizations, but no action has been taken. We are about a year after this response, and that situation has actually not changed for that organization and many of the other organizations that we work with. And that really speaks to me, that really speaks to the core of what this report is saying. Thank you, Maddie.
Caroline, thank you so much. It's so great to have you here to really articulate so clearly what's happening in West Africa with your partnerships and with your grantees. It's really exciting. And we're going to turn now, and I'm going to invite Jessica into this conversation. Jessica, thanks a bunch for joining us today. It's really great to have you here. And we have Jessica and I had a great pre-conversation for this call, which I want to have every day. But here's my one question that I'd like to ask you to sort of think through with us. Very early on, Outright Action International, commenced a really comprehensive documentation of the impact of the pandemic on LGBTI communities across the world. And we reference this in our report. It's an excellent report. And since you released that report in the mid-2020, what else have you been learning from your partners across the globe about the impact of the pandemic as it stretches into the second year? And just to note, you have an sort of extraordinary multiple levels of relationship with partnerships as you've been providing emergency grants and also in your traditional political partnerships. So I'll open it up to you and invite you to share what those learnings may have been and what they look like as they're happening real time.
Thanks so much, Maddie. I really, really appreciate the opportunity for this conversation you've convened today. And, I'll just repeat the plug that I made to you privately, which is, I think this could be a conference. So let this be the first of many. And I also just really want to congratulate you publicly, Dave, for this report. It's so useful. It's almost like I didn't know how I was doing my work before I had it. So it's a huge help. And I looked quickly at the participant list of this meeting, and I just see so many colleagues and friends. So I'm really glad that we have this space here together, since I know so many of us are grappling with these big picture questions. For anyone who might not be familiar with Outright, just a very quick introduction. We're a global LGBTIQ and feminist organization with offices in 8 countries, and our 3 primary ways of working are research, advocacy, and resourcing. Oh, and we just turned 31 years old, or 31 years young. So Maddie, as you said, part of what grounds Outright's evidence-based approach to the COVID pandemic are 2 core resources. A research report that we produced, Vulnerability Amplified, which Dave displayed in the slideshow, written by Ami Bishop, and also an emergency grants fund that we created. And so just quickly with regard to our COVID LGBTIQ emergency fund, we have so far distributed just over $1 million in grants to 125 organizations across 65 countries. And the focus of that grant making mechanism was sort of like, quick and flexible. So quick turnaround. Then we provided grants between $2,500 and $10,000 US in general operating support, because we knew that LGBTIQ organizations, and I should clarify that we only made grants to self-identified LGBTIQ organizations, whether or not they were registered, across 9 languages. We gave general operating support grants because they know the needs of their community and they knew exactly what to do. And then sort of bolstering that grant making function, we issued this report. And the report had 7 core findings. And I'll just sort of rattle them off quickly because they connect with what we're seeing now, a year into the crisis. The first was devastation of livelihoods and rising food insecurity. The second was disruptions in healthcare access and also reluctance to seek healthcare, which takes on a new meaning as we try to figure out community access to the vaccines. The third was elevated risk of domestic violence. The fourth was decreased mental health. The fifth was elevated discrimination, violence, and scapegoating. The sixth was state abuse of power. And the seventh was anxiety about LGBTIQ organizational survival. And, you know, we've been talking with activists and partner organizations throughout, and really our conclusion now, you know, 10 months, 11 months into the crisis, is that unfortunately, the more we talk to activists and the more we see data being released from other sources, the more validating our initial findings were. So what we found back in May has actually held true. And unfortunately, it's either stayed the same or in some cases, the situation has gotten much more grave. The only real difference would be variables based on geographic specificity. And so Outright talked with some leading LGBTIQ activists from every region of the world in October and December as sort of a way of following up the conversations we did during the interview phase of our research 6 months earlier. And I just thought I'd share a couple of examples of what people said to us. With regard to food shortage and livelihood impact, people said the livelihood devastation was continuing and worsening. And this makes sense because not only is this the economic crisis impacting everyone, LGBTIQ people were overrepresented in the informal sector. They were working in restaurants and bars and entertainment and tourism, all among the industries most hard hit. With regard to issues around mental health, I have to say it has just been devastating to talk with people. And, you know, I think in general, folks were prepared for sheltering in place for a little while, but, you know, a year into it, people are really not okay. And I think especially when you talk to young people or gender nonconforming people, anyone who's stuck in a home where their identities are not affirmed, there's very severe consequences. So we continue to see a spike in domestic violence, and it leads to stress, feelings of anxiety, depression, and devastation. And then I just want to give maybe two more examples about the sort of broader pattern. One is the phenomenon of scapegoating and violence. So, you know, if you like your German political philosophers, then surely you know Gilbert Hurt, who says that in times of national transition or crisis, moral or sexual panics develop. And that's really something that we've seen, because when you can't control something that's happening that almost feels too big and too dangerous and too threatening to the community or the nation or even the world, then we look for someone to hold responsible. And we see that LGBTIQ people in place after place are being blamed. And we talked to a colleague in Ghana who said, look, you know, whenever an election comes around, you know, politicians increase their anti-LGBTIQ rhetoric. But because of the pandemic, the election was postponed from July to December. And as a result, we were at a sort of fever pitch of anti-LGBTIQ rhetoric, the likes of which we haven't seen in a long time. And it's only creating fear and violence. And then the last point I want to make is just that, you know, the truth is LGBTIQ organizations are reeling, and all the data that Dave provided and Caroline provided really emphasizes this. You know, we didn't stop doing our pre-pandemic work. We just absorbed all of this additional work. So if we were doing human rights work before, now we're doing human rights and humanitarian crisis work. And when we talked to these activists and organizations, they said, our work before was essential, but how do we rebuild it now? They said to us, for the first time, we're providing food and shelter to our community members. They said, we're expecting more challenges, more loss of jobs, more worries that the progress that we have fought for and gained over the past years is going to be threatened. And people even told us, you know, if it goes on like this much longer, our organizations are literally going to shut down. And of course, we know that the digital divide has just worsened the crisis. So those who can mutate their activism to something online, maybe just barely, are coping, but those that don't have good digital access are really suffering. So I also have good things to say, but Maddie, I'm gonna just check in with you, and I'm thinking maybe I should pass the baton and do a time check.
That's great. I appreciate that. And we're going to come back and have more of this conversation because there is good stuff that we can look forward to. So I appreciate that. And
We'll get it in the next round.
yeah, we'll get it the next round. And also I encourage you to visit the Outright Action International's website because they have a lot of COVID-19 resources as well. So, so now I'm going to invite Nikki McIntyre into this conversation. Welcome, Nikki. Thanks for making time for us this morning.
You're welcome.
New York time. Great to have you here. I'm going to just jump right into my question, which is, the Foundation for a Just Society is explicitly a feminist, intersectional human rights funder that, what people may not also know, is also a direct services funder to some degree, and has scaled up support for LGBTI movements in recent years. And as we saw from the report, and also what we just heard from Jessica, many LGBTI organizations shifted their activities in this last year, addressing the pandemic, obviously. As the CEO of FJS, how do you assess, and how can you talk a little bit about how your grant-making organization, including really your board, your staff, responded and has dealt with these shifts? And I guess that, if you could just build it in, you had some muscle around direct services. So there was knowledge and institutional memory around this. And how did you lean into that during this totally unprecedented crisis?
Well, thanks so much. Thanks so much, Matty, for having me be part of this discussion. And just to say, to build on Caroline and Jessica's comments, that this is a really useful report to everyone. So congratulations, particularly Dave, for everything that went into that. So let me just say, like many public and private foundations, we've sought to be responsive over the last year to the shifting needs and priorities of our grantee partners, who for FJS, Foundation for a Just Society, are across several regions: Francophone West Africa, Mesoamerica, South and Southeast Asia, also in the United States, in the southeast of the United States, and then we also have a global portfolio. And our board moved very quickly in 2020 to decide to meet actually on a monthly basis versus 3 times a year, given the unfolding of the pandemic. And really early on, the board encouraged staff to do what we needed to do to meet the urgent needs of our grantee partners being affected by COVID-19, including LGBTQI partners. FGS funds women's rights organizations, girls' organizations, LGBTQI people's organizations. So we're not solely focused on LGBTQI folks, but it is a growing community of grantees in our work. And so, as you're hinting, and maybe you're hinting too strongly, because I would like to say, it wasn't such a big pivot for us. While we prioritize groups, and we very much do prioritize groups that are working on structural change and are mostly using advocacy as their key strategies. Nonetheless, many of the groups that we have been supporting are providing some level of direct service to their communities. And we've always been fine with supporting this, and our board has always been fine with supporting that as well. So I don't know, I think it might be too far to say that we have huge expertise in direct services. I'm not clear that that's really the case for us. But many of the groups that we work with, and I think I think everyone on this call would probably concur with that, don't have the luxury to solely focus on advocacy. They're also deeply embedded in the communities that they are supporting, and they are doing some kind of direct service along the way. So just practically, what did we do? So the first thing we did was remind groups that they had full flexibility in how to use their open grants with us. And most of our funding is already in general support. Sometimes it has to be restricted because of US tax law, but even there we try to make it as flexible as possible. But nonetheless, we contacted groups to let them know that they could shift their resources to any areas of need arising from COVID-19. The second thing that we did was to simplify some of our grant making processes. We simplified our proposal submission process to ask grantees just a few key questions, understanding just how overwhelmed groups were. These might be groups that were up for renewal, as well as new groups to us. We also revised our reporting process for grantees so that they could submit reports that they'd already written for other donors, or substitute a written report with a brief phone call. So we also did that. And the third thing that we did was repurpose money from our 2020 grants budget to support the emergency needs of our grantee partners resulting from COVID-19. And internally, we kind of refer to this as emergency grants, but these were grants that were made on a rolling basis outside of our 3 grant making cycles of the year. So they could be pretty responsive, and we developed a simple application that asked only 3 questions. How have you been impacted by COVID-19? How much is your ask? And how would you like to use your emergency funds? Similarly, we made it simple for our program staff, who were also under significant pressure in terms of the numbers of new grants that were going out, and also for other reasons in the year, some additional grants were happening. We made it simple for them to write up their docket write-ups, and we got those grants out the door quickly. These were grants that did not require board review, so that also helped to really speed up the process. So in the end, we ended up making over 1.8 million in emergency grants to about 45, 46 grantee partners. So yeah, those were practically the things that we did.
Very helpful. It's very helpful. Thank you for that. And I think also people who take a look at the report will see that a lot of what Nikki just shaped out, there is some real parallel in many of the other private LGBTI foundations or private foundations that support LGBTI communities. So thanks for that, Nikki. I'm going to pivot a little bit to April right now. Welcome, April. Thanks for joining us, and I appreciate your grace being the 4th of 4 people to speak. So I'm excited to hear you. Welcome.
Thank you so much.
Yeah. So here's my question that we reviewed a little bit with you and had an earlier conversation about that. But given that LGBTI organizations shifted their efforts towards these humanitarian responses, we researched the global humanitarian responses to understand if LGBTI groups accessed funding through these resource flows. And obviously you read the report and we're having this conversation, it just didn't happen. So I wonder, from your perspective as the senior gender advisor and head of the gender unit at the UN Office for the Coordination for Humanitarian Affairs, what lessons could you share with us on this call today from your experience and expertise of the work of integrating gender equality into humanitarian responses that you think would be useful for LGBTI actors to think about in starting conversations with humanitarian actors to make the field more LGBTI inclusive? And how can we move beyond this idea of LGBTI communities either do not have specific needs in times of humanitarian crisis, or addressing such need would cause harm. So that's, it's a lot of pieces, but I'll just open that space up to you and invite you to, pick that up where you want to.
Sure. And, let me just start by thanking you both, Matt and Dave, for putting this really important report together. And I really concur with my colleagues, Caroline, Nikki, and Jessica, in terms of really illustrating why we really need to give a bit more focus and dedicated attention to move this agenda forward. But I feel that I also need to put a very fine point on the fact that I don't think the absence of the mention of LGBTI communities in various project proposals and funding proposals, I don't think we should read from that there is not an interest, or that there is not a willingness, or that the funds are not being channeled to support, vulnerable populations, including LGBTI. I think absolutely there is so much more to do, and we must do better. And I think, we can work together to make the issues more visible. But I just want to put it out there that it is not from an absence of interest. For example, in my own organization in OCHA, the Office of Coordination for Humanitarian Affairs, we constantly have the conversations around which groups are marginalized, how do we ensure that we're not leaving anyone behind, how can we have a bit more targeting and focus on particular groups, recognizing that we may ourselves not have the expertise, to provide the support. So how can we better engage? So if I can just start with a couple of reflections, because some of the points from your report and the colleagues have raised so far really resonate with me in my work on gender equality. We recently had an interagency evaluation of how the humanitarian system has worked on broader issues of gender equality and the empowerment of women and girls. And that report illustrated a couple of things. It says, yes, of course, we've made some progress, but my goodness, we've still got a long way to go. And a couple of things I think, we can take learnings from is firstly that issues around gender equality are just not embedded in the institutions, in the way that we practice. Secondly, that the issues around participation and leadership is something that is still a critical gap. And then the third point is around the need for funding and resourcing. And if I can just speak to a couple of this, because this is what your report highlighted. It basically says to work on issues around gender equality, we have to value and respect it. And we have to provide the adequate resources and technical expertise. You don't have just anybody willy-nilly working on gender equality, because obviously the mainstreaming approach, while needed, is also not working. We also need targeted interventions where you have dedicated technical expertise to give concrete guidance on, what are some of the specific issues for women and girls in that particular context that need to be dealt with, whether that's exposure to gender-based violence, whether that's, food insecurity that further exacerbates gender inequalities. We need to identify and have, proper analysis. And I think that is the same for LGBTI issues. We need to make sure that we are able to do that analysis and to bring out more specifically what are some of the needs and experiences, but not only needs and experiences, but the capacities of LGBTI people to respond to the crisis that we can build on. And I think that having the ability to focus on some of those specific issues will help give more visibility to some of the issues, to some of the concerns that you've raised. Another point that I really want to highlight is this issue of the invisibility, of LGBTI issues and persons. And I think sometimes in some of the contexts that we've worked in, that is also by choice by some groups, because that is also their means, of protection. And I don't need to, to harp on that point too much. But I think that there are sometimes deliberate attempts to not be so visible, but to continue to do the work. So how do we have this inclusion, but also make sure that it's balanced with protection mechanisms? And then one of the critical points that I really want to highlight is going back to this issue of participation. In this report that we just did on women and girls and their empowerment in humanitarian spaces, it says that yes, women and girls are being consulted, but they're still not being included at the decision-making table when strategies are being developed, so that they're still not influencing programming and decision making. And it goes beyond just women and girls. It's just, while the report is focused on women and girls, it shows that even though there's a little bit of progress for women and girls, other marginalized groups, including LGBTI communities, are not even being consulted. So, definitely on the point of participation, a long way to go. And we must also encourage and push the conversation beyond just being consulted, but that, LGBTI community members need to be at the forefront, driving strategy, informing decision, and are seen and valued as key informants or key stakeholders in this whole conversation on humanitarian action. And I think there's some good work, in particular in the Asia Pacific region. My colleagues working in the Asia Pacific Gender Working Group have been working quite actively with UN, in particular with the leadership of UN Women, to really showcase, what are some of the good practices of working with LGBTI individuals in humanitarian crisis. So I just wanted to give a plug to them. And then the last point, before I throw it back to my colleagues, is this whole idea around localization and the role of local communities, local stakeholders. I think we can't stress this enough. So I think if we have opportunities to funding needs to go into these local organizations who are there before crisis, who are there during crisis, and who are mobilized after crisis. They're there because they have to be. And so I think we need to capitalize on that and to see that that is a rich resource of support for all segments of the population. So these issues around, localization, the need to really support and strengthen capacity of organizations as well. I heard earlier, we were talking about how do organizations engage in the humanitarian architecture. Sometimes it is very complicated. So you may have organizations that exist, but they can't access the system. They don't know which clusters, which meetings to go to raise the issues, to find out about the funds. So how can we make the system more accessible? And how can we ensure that organizations are aware, informed, and have the, the technical know-how to engage in those systems as well? And so, so if I can just conclude on the point that there's a lot of learnings in the gender space, but to also say that it is not the fact that we haven't moved very far is not because of lack of political will. I know that during COVID, organizations, in particular OHCHR, really really went out of their way to put forward guidance, on how we work with, various marginalized groups, including LGBTI communities. And just one last plug. In my own organization, when we're talking about funding, we are trying through our own humanitarian pool funding mechanisms to prioritize and to help target marginalized communities in Bangladesh, in Honduras, in Venezuela, and also in Lebanon. We've provided funding to support LGBTI communities, and in particular to cope during COVID. So there's definitely, efforts, but we can do much more. So maybe I'll stop here and welcome comments from other colleagues.
That's great. April, thank you so much. I feel like the very natural next speaker would be Jessica Stern, who Outright Action International actually does a lot of the capacity work in movements to properly prepare and create the conditions where communities can be at these tables. So it's very exciting. I'm going to ask you a question, Jessica, but I also encourage you, if you're so moved, to respond to some of what April just laid out for us. So here's my question for you, Jessica. So what do you see as some of the barriers, but also really some of the big opportunities for LGBTI civil society and grant makers really to engage with the humanitarian response actors in order to make humanitarian responses more inclusive of LGBTI communities? Yeah, so I'll pass it to you.
Thanks for that question, Maddie. And, April, I'm just so glad to know that you're such a strong ally. I feel like part of the value of a convening like this is to find out about the work that you're doing and the strategy, the inclusive strategy that you deploy. So I already dug out your email, and I'm sending you a message to follow all of this up, because I think your observations are really enormously helpful. And I especially want to lift up the point that you made about how complicated it is to access the resources in the humanitarian system. And I want to say, like, that's a major difference between the humanitarian system and the human rights system, where the scale that you're working on is just so much larger. And for our small community-based grassroots LGBTIQ community organizations, that don't have a lot of staff, I think navigating those bureaucracies is not easy and really requires very intentional interventions, which I imagine you have some ideas about how we could do. So Maddie, thanks for that question. Let me say, I kind of answer this question with a real sense of anger and also an enormous sense of opportunity. And the anger comes from the injustice at LGBTIQ exclusion in times of the most severe crises you can imagine, and a real sense of opportunity that you had almost 500 people RSVP for this call today. So we've identified the problem, and there's a growing community of us, very diverse stakeholders, that want to do something about it. So I thought I would just start with the question, the part of your question that's about barriers. The question is, why are humanitarian programs difficult for LGBTIQ people to access? And I think there's a few different issues there. I think a lot of humanitarian programming assumes a heterosexual family as a primary unit for service and goods distribution. And so long as that's a primary mechanism in humanitarian programming, then LGBTIQ people, whether they're single or in families, are going to fall through the cracks. I think another challenge is that humanitarian interventions are, by definition, resources and institutions from the outside that are swooping in because of an emergency. And so in ways that are, I think, intended to be really constructive, humanitarian interventions often try to tread very lightly, in essence, not to disrupt the status quo or the conditions that pre-existed the crisis. But if the status quo was unequal before the crisis, then the question is, how do you respond in a more equitable way during the crisis? I think another piece that's a significant barrier is who distributes resources, who develops the architecture for humanitarian relief. And the truth is, we're often talking about governments or even religiously based charities, which are not known for being LGBTIQ friendly. And, another issue that has sort of come up a little bit in this conversation, but probably is worth emphasizing, I think that in the context of mass tragedy, everything is there. There are never enough resources. So many people are in crisis. April said earlier, we're trying to reach so many different populations all at once. And in that context, you can almost imagine that people are saying, why should we think about a statistical minority? Or how do we think about a statistical minority when we're trying to reach as many people as possible? And I think the answer is that it's absolutely essential to think even about statistical minorities, because not only do minorities test the strength of the system as a whole, but if resource distribution is not inclusive, then humanitarian efforts themselves become responsible for exacerbating pre-existing inequalities, which leads to hunger, homelessness, and even death. And so I'm thinking, like, what do we do about it? What are those opportunities? And I think there are a lot of opportunities. I love a list. And so I've got at least 8. So I'll try to just go through a few of them very quickly. I think one is this nexus between LGBTI rights and women's rights or gender justice. And I think, it would be wrong for us to come away from this conversation thinking our strategy should be to take away from women's rights and take for the LGBTIQ community. I don't think that's what anyone in this call is trying to say. I think what we want to say is that women's rights work and women's inclusion in humanitarian contexts is underdeveloped. And as a queer community, with both members that identify as women and as a community that seeks to be in solidarity with other excluded populations, part of the solution is funding women's rights work in humanitarian contexts. I think a second piece is ensuring that when the word gender appears, it doesn't become code for women and girls. Because actually, the inclusive move to use gender instead of women and girls in humanitarian documents, in human rights documents, comes from a desire to cast a broader net. And we need to ensure that queer people are included in that. And then I guess, at a minimum, the third and final point I'll make is that women and LGBTIQ people need to be more adequately integrated, mainstreamed, and resourced across all humanitarian initiatives. So those are some of the places where I would start. And I just want to say there's so much opportunity to do this. There's so much opportunity to do it right, to do it better, to seize the lessons learned from COVID. And it has to start now.
Thanks, Jessica. I really appreciate that. And I agree. This is, the complexity of these conversations and the diversity of stakeholders that we need to engage actively in these conversations. We hope that, the work that all of us have been doing really catalyzes, a time in the future when we are able to have really robust, deeper conversations that you're right, maybe a conference. So Caroline, I'm going to pivot to you. And also I want to recognize on the call that we have about 15 minutes left on this call. We may not get to all of the questions, although I am trying to incorporate them into some of these questions. We will do our best to respond to those questions on the webpage or email them directly back to you. But just to let you all know, I'm having a moderator's prerogative and ensuring that the questions that we've discussed with our presenters, they're able to address. So I really appreciate everyone's grace around that. So thank you. Caroline, I'm bringing it back to you because the region in which ISDAO works in West Africa is very diverse, linguistically, culturally, ethnically. And given that you make grants across this really complex environment, I want to talk a little bit about these country level implementation partners for humanitarian aid. And they are, as Jessica just said, many of them are often faith-based and risk having explicit trans and homophobic policies. So I guess a question for you is, what challenges does that present for responding to LGBTI needs? And also, how could you imagine a better capacitated civil society to make the appropriate negotiations so that LGBTI people can be included in the way that all others are included?
Oh, answer in a minute. I know. Not a simple question at all. Thank you so much, Maddie, and I'm appreciative of the opportunity to pick up on a couple of threads that have been flowing throughout the conversation. You know and this is it's an important and challenging question. Even up till now, you know, a year later, when we talk with our grantee partners about where they've gotten support, if it's not from existing donors, it's been from responses from mechanisms like outright COVID fund. It's been from the Rapid Response Fund, from AGID in Francophone countries, or through local HIV organizations or broader civil society organizations. There's not yet been a moment where I've heard a single local LGBTI partner saying we've gotten humanitarian assistance or we are part of a conversation with one of the larger humanitarian organizations. So, and that's across 9 countries. So that's a really significant gap. There are some resources that are available, but they're very limited, and compared to kind of the broader scale that exists within humanitarian organizations. So what that means in the context that you describe around local implementing partners is that local LGBTI organizations, even when they are doing effective critical community work, they're not recognized, they're not visible, they're excluded from the humanitarian response, but they're also excluded from these conversations. And we know, add on the additional aspect of criminalization and the difficulties with registration, where if you're an organization that doesn't look a particular way, it's not registered, in a criminalized society, you're not going to be invited to a conversation with humanitarian actors, that the leading humanitarian actors. So there's all of these dynamics that impact whether our communities are even able to be in the conversation. One of the things that it's really clear for us is that local LGBTI organizations need to be better resourced to document and to speak to these issues and speak to the realities, to generate their own research, to do knowledge production, because what we've seen in the past is that can help to shift the needle. That can help to move things when there's local organizations saying, this is our reality. This is not an international organization saying this is a reality in our country, and this is a reality of our communities. That helps to bring people in to the conversation who may not otherwise be there. And that's something that we've seen to be effective and more of it needs to be supported. We also recognize that local or LGBTI organizations have often sat outside of conversations around accountability, around budget tracking within their country, around governance. And that is also something I think this moment has highlighted that has to change. And so looking especially those of us who maybe are grant makers or international organizations that are working across sectors and communities, how can we ensure that in these conversations around governance, around accountability, that LGBTI local partners are included, that their voices are heard? Because it's really hard to have an impact on a broader conversation around holding government accountable around humanitarian response if you're not even in the room. You don't have the language and you don't have the tools and you're not even in the room. Finally, I think there's another role that funders and allies to LGBTI local organizations can do. We can be relays of information, because sometimes we know about the strategy or the policy at headquarters or what should be happening, and we might have certain access to certain information that our local partners might not. And it's not saying act on their behalf, but how can we be in solidarity and support by being relays of information that help local partners strategize, that help local partners advocate. So there's a symbiotic work that can also happen and that needs to happen with funders and international organizations and allies who want to see change actually help and support and resource local organizations to develop strategies and implement strategies that are starting to do that.
I want to talk to you about this all day. Caroline, thank you for that. And recognizing, as you did at the beginning, this is a lot. This is a lot to cover in such a short amount of time. Nikki, I'm going to circle back to you and ask you a familiar question from our questions that we prepared. So what do you see as some of the potential challenges and opportunities of human rights grant makers like FGS in engaging with and activating humanitarian response donors and mechanisms to be more explicitly inclusive? And also, are there lessons that, you know, your career has spanned some of the most consequential institutions in LGBTI and feminist work in the world? So from your perspective, like, what are some lessons we can kind of lean into at this time?
Yeah, thanks so much, Matty. And I'll try to be really quick because I'm very conscious of how little time we have at this point. You know, on the one hand, I think it's brilliant that so many funders have kind of pivoted in as the report shows, and given the flexibility to their grantee partners to respond to the challenges that they're facing right now. But you know, we know that LGBTI human rights funders alone can't provide the resources that LGBTI people and their organizations need at this point. So, I mean, for me, it's like, you know, it's both an opportunity and an absolute necessity that, you know, human rights grant makers and humanitarian response funders and implementers, you know, come together to kind of really try to move this dial and soon. And I think this report really, you know, opens up some huge opportunities or some directions, gives us some directions on how to do that. So I think the opportunity is that we, as well as the challenge, that we need to figure out how we capacitate ourselves to do this, and how do we as funders, because our role in this can be as funders, how do we fund the advocacy that can create new flows of funding to LGBTQI communities around humanitarian assistance and direct needs. So I think in terms of like my lessons learned, my experience of watching other funders from different sectors come together across sectors, and I think we've seen a growing focus on this within the women human rights community, with women human rights funders and, let's say, environmental funders, sometimes environmental and sometimes environmental justice funders coming together, the Global Action for Green and Gender Action, GAGA, which is led by the Central American Women's Fund. This initiative is a great example of that. But what it does is that the lessons learned from her is it's really hard. It takes a lot of work, and we shouldn't fool ourselves about that. And I think we've historically had very, very little engagement with the humanitarian sector. I suspect we each have very strong opinions about the other. We don't speak the other's vocabulary. We hold myths, some of which we learned about in the report. Well, LGBTI organizations are too small to cope with any of this kind of support. We have different goals, funding mechanisms, different constraints. All of these things create massive challenges. And I think the biggest lesson is that the exchange needs to be full on, it needs to be intentional, it needs to be consistent. And we literally, as Jessica was saying earlier to April, literally need to get to know the players better. We literally need to be building trust. And unfortunately, I think this takes years, and I think we have to be realistic about that. So I don't see this as an immediate solution for COVID-19, unfortunately. And that's really devastating. But we know that there will be more pandemics. Who knows how long this pandemic will go on? It may go on for years yet to come. And we will have growing disasters from climate change as well, and many other things. So we need to at least start the work, and I don't mean to be disrespectful, because I think others have started the work, but build on that and really move it along. And that is a role that funders can contribute to. And I think we also need to be clear, like, what is the goal among us progressive funders? What is our ask of humanitarian actors? And I think there's a couple of things that I'm hearing from the report. We want them to see LGBTQI organizations as recipients of funding and access points for services and relief for LGBTI communities. But we're also wanting humanitarian actors to more effectively themselves reach LGBTQI communities with their services. But what's the pros and cons of each of those strategies, and what approaches make the most sense? So I think those are some questions I have, but it's not an easy path that we're embarking on, and it will take funding to do the philanthropic advocacy, to do the networking. And I hope others in the funding community will step up to this, or I think it will slow the process down tremendously.
Thanks, Nikki. Really clear, much appreciation. We have just a little bit of time left, and I'm going to invite April for the last comment, and then I'm going to wrap up our call with recognition and appreciation that the questions have not all been incorporated into this conversation, and we'll address that as staff after this call. So April, I want to quickly turn to you and think, like, what are some of the things we need to do to move this forward? I mean, you know, this is a conversation that's really for very unique, different kinds of infrastructure that are looking at a shared problem. So where are you at this conversation? What do you think we need to do to move this forward?
In 2 minutes, I'm going to say I concur with everything my colleagues on the panel have said, so I will not repeat any of those points, but I have 3 concluding points I really want to stress as we conclude the conversation. Firstly, the idea of leadership. I think this is what we really need in order to push this forward. And I'm not talking about leadership as in the 4 of us on this panel, but it's about leadership in the other institutions that we partner with. That makes a big difference. If you have people who say these issues need to be more visible, I want these organizations engaged in the conversation, then that also takes it forward. And how do we mobilize leadership? Donorship. If you can get donors and member states to say these are their priorities, then it really shifts the conversation. Organizations will start being much more inclusive when they're being told that they have to be inclusive. Sorry to be so instructional, but sometimes you need that in order to make a point about prioritization. And then the third point, which we've been talking about, but I don't think we've stressed strongly enough, is the need to really harness the grassroots movements, because that's where the answers are. And it's about how do we give visibility to the organizations, local organizations that are already doing this work, that are doing the critical advocacy to be seen, to be heard, and to lead some of the response. And I think that some of the advocacy that can be done to make this a bit more visible needs to go to the global protection actors and the global protection mechanism, which we call the global protection cluster of the humanitarian architecture. That's the home of a lot of the issues around vulnerability, accountability to affected populations, and ensuring that nobody is left behind, and the risk and protection experiences of all populations in humanitarian crisis are responded to. So I do think there is a lot of scope for all the organizations participating on this call and in the report, and your partners, to really galvanize around the advocacy to the global protection actors and architecture. So my 3 points, again, leadership, accountability, and harnessing grassroots movements. Thanks.
April, that's such a wonderful way to wrap up this call. I really appreciate it. Let's go to the next slide, actually, Marina. So I just want to thank all of us who joined the presentation today, and the speakers and all of us here at GPP are deeply committed committed to expanding philanthropic knowledge and collaboration and to grow and improve resources for LGBTI-led movements around the world. If you're interested in working with us around any of these issues and around COVID-19, please reach out to us and let us know on the survey also. We have a lot of work to do in this collective action, and now more than ever, we need each other. This is not a time for heroes. I'd like to thank each of our speakers today, all of whom shared their grant making and data and contributed in a lot of ways to the success of this call, so thank you. I also want to thank my colleagues from the Global Philanthropy Project. First, the first two co-authors, Dave Scamell, our Senior Liaison for Government Relations, and Ezra Nipon, our Senior Program Officer for Knowledge and Learning. And also, of course, Marina Gonzalez Flores, our Program Officer for Member Engagement and Operations. I want to thank our Executive Committee and our 21 members without whom here at GPP we could not have done this work. And today's discussion really holds out a light for all of us as we work to scale up the funding to meet the real legitimate needs of our LGBTI communities and to mitigate the inequities in funding that we've already seen and are being exacerbated by this pandemic. And I want to thank the nearly 500 folks who registered for this call and those of you who were able to join us today. And I also want to encourage you to be ambassadors for these findings in places and spaces, in boardrooms, policy desks, grant making, executive sessions, docket reviews, and all the advocacy spaces that we all move. It is our shared responsibility to do that. And although we may not have met in person, I hope we do so in the near future. And together, our continued collaboration, shared learning, and mobilization is critical to the sustainability and vibrancy, dignity, livelihoods of our communities around the world. So may our work continue and be newly energized by today's call. And I really thank you and send my deep regards to all of you. Have a great rest of the day, everyone.